the Toronto Star. I'm Saba Itazaz, and this matters. Two months ago, our American neighbors were celebrating post-lockdown joy, vaccinations were up, and COVID cases were down. Now it's fast going the other way, and the country's top doc, Anthony Fauci, is doing TikTok interviews in a desperate bid to stop the spread. COVID cases are rising in all 50 US states, driven by the Delta variant that's surging in places where vaccination rates are low.
Just 4 states accounted for more than 40% of all cases in the past week, with 1 in 5 of all cases occurring in Florida alone.
Top American health officials say that more than 99% of all COVID deaths in the US now are people who haven't been vaccinated. President Biden was very direct, pointing tech companies and rampant misinformation through social media platforms such as Facebook for allowing misinformation to spread online.
Look, the only pandemic we have is among the unvaccinated, and they're killing people.
So what changed the game so quickly in the United States? It all came down to who got vaccinated and who didn't.
There is a clear message that is coming through. This is becoming a pandemic of the unvaccinated.
A scary message for Canada and other countries grappling with vaccine hesitancy and in some cases, just plain vaccine denial. Just 2 months ago, the Star's Washington Bureau Chief Ed Keenan and I were having a chat about post-lockdown joy, New York reopening, and successful vaccinations. Now we're back talking about the opposite. What happened? Ed is here with us to try and find out. Hi, Ed. Thanks for joining me again.
Saba, it is such a pleasure.
So, Ed, the virus seems to have surged again across the US, just as we thought things might be getting back to normal. And after such a successful initial vaccine rollout, what happened and how bad is it? Is this the Delta variant changing the game?
It is. And I was just thinking this morning before we talked that the last time I spoke with you for this podcast, I was in New York City on the first sort of official day of reopening, and there was such a joyful, triumphant mood there. And since then, across most of the United States, things have gone back to normal to a large extent with, fewer and fewer people wearing masks, even indoors, restaurants wide open. I was in a different part of Maryland recently. I was in a beach town on the East Coast, and there you could kind of just forget almost that the pandemic ever happened. In medical offices or grocery stores especially, you'd still see some masks, but elsewhere, the idea that they had become optional for vaccinated people became basically that very few people outside of major cities were wearing them really anywhere. And now the problem is that especially in areas with very low vaccination rates, what we've seen, and maybe in retrospect it was predictable, is a sort of massive spread of the Delta variant creeping back up. The director of the Centers of Disease Control said that cases were up 60% across the country week over week. The week before that, she had briefed and said that cases were up dramatically. And so, the United States is not back at the sort of horrifying point it was earlier in the pandemic. The first wave caught hospitals unprepared. The fall wave and the winter wave were kind of particularly brutal in sort of the numbers. They're not back there yet, but they're heading in the wrong direction. And I would just say that I wrote a piece that appeared in the Star that talked about the border issue. What I noted in that piece is that aside from any specific policy, what you see is a reorienting of the entire government apparatus away from the lifting of protective measures and towards re-implementing some of those protective measures. And so, the Centers for Disease Control in the United States changed its guidance to suggest that even vaccinated people should, return to wearing masks indoors, especially in areas where high community spread. They said that, they suggest masks this fall for all school children, K to 12, in classrooms. New York City is mandating vaccines for its residents. Los Angeles is returning to mask mandates. And so there's a shift of gears away from we're getting back to normal and towards it's not time to panic yet, but maybe start to panic a little bit.
So a few steps back from, there were plans to fully reopen by July. So there are some shifts that we're seeing here. Is that the context in which CDC Director Rochelle Walensky is calling this a pandemic of the unvaccinated? Are unvaccinated people, particularly anti-vaxxers, affecting the rise in hospitalizations and the increase in cases right now?
Yeah, well, I mean, I think there's several elements there to what you're talking about. But this vast community spread is, according to the CDC director that you mentioned and many other experts, it's particularly spread among unvaccinated people, right? And so the problem in the United States, there has been enough vaccine in this country, in the US, since the middle of spring to vaccinate everybody who wants one. When we talked and I was in New York City, there were like mobile walks up vaccination clinics, like no appointment required. Just walk up, get your shot, right? And that's been the case here across the country, basically, for months. So everybody who wants one can have one. And yet only 50% of Americans are fully vaccinated at this point. I think it's 56% who have at least one shot. Those numbers aren't moving very quickly. And so, well, in raw numbers, there's still a lot of vaccinations happening in this country. As a percentage of the population, it's slowed right down. And what we're hearing is that the vast majority of the spread of this virus and the overwhelming majority of hospitalizations and deaths are among unvaccinated people. And so, the first part of your question about the pandemic of the unvaccinated, is that where earlier this was a disease that was really attacking unhealthy people, older people, and not just to say that those people were the cause of it or that those people, lived in a different world or were even more likely to catch it. It was that the toll was taken on those people. And now the toll is being taken on unvaccinated people. The question becomes, as you said in sort of the second part of your question, well, why are people remaining unvaccinated? Canada, which initially struggled with its vaccine supply, had way less. And people in the US are noticing, newspapers had headlines about it, that Canada, more than a week ago, passed the United States in its fully vaccinated rate. Long ago, it passed in its first dose vaccination rate. Justin Trudeau has announced that now there's enough supply in Canada to vaccinate everybody who's eligible right now. And I think most Canadians fully expect the numbers are going to continue to go up, that there's still an upward trajectory. While there are vaccine hesitant people in Canada, there's not as many. Here in the US, there's a set of overlapping factors. And one of the big ones is that overwhelmingly people in rural areas, in the South, in the Midwest, people in Trump voting states, and especially among Republican heavy areas, are really reluctant to be vaccinated. And they associate the vaccine with the left. They associate the sort of the pandemic being a scam or overblown, the whole idea of masks and vaccines now being a sort of a grab for control over people's lives. There's a lot of currency to that among right-wing people in particular. The same people who have embraced a lot of conspiracy theories about how Joe Biden and a cult of cannibal pedophile Satanists is secretly running the world. Those people also believe in conspiracies, some of them, that say that basically the vaccine is an attempt to rewrite their DNA and control them and impose the government's will on them. And so that's a part of it. And one thing that we're seeing, I don't want to just ramble on, but one thing that we're seeing now is that Republican political leaders, many closely associated with Trump, have started becoming much more vocal in their advocacy for vaccines just within the past week or two, because I think they're looking at the numbers and recognizing this thing is killing off and hurting our base. And maybe we haven't been loud enough in the message, or maybe we've been contradictory in our message. And so, Sarah Huckabee Sanders, who is running for governor of Arkansas, but used to be Trump's press secretary, she had an op-ed where she's saying she's proud to take the Trump vaccine, that it was developed under his warp speed proposal. And the reason why people don't trust it is because Biden has completely botched this up and made people mistrustful. And so she's trying to rebrand it as a kind of stick it to the leftists and Biden by getting the Trump vaccine. And hey, if it works, I think a lot of people, including maybe in the Biden administration, will take it.
We'll be right back. I I've seen a lot of different takes on Fox News and a lot of people changing their tunes recently as well. And from what you're saying, Ed, the US seems to be facing a unique problem in the sense that where a lot of countries might be grappling with not enough vaccine doses, the supply seems to be plentiful in America, but not enough people at the moment are utilizing it, right?
Yeah, I mean, Canada maybe now too, and maybe some other countries, but the United States was uniquely positioned early on as the only country in the world that really had it within its power to eliminate the virus within its borders fairly quickly. And they haven't done that. And I'm sure India, which produces massive amounts of vaccine, but has sold them to other countries and only has, I believe I read 4% or something like that of their population fully vaccinated, and has such a massive population to vaccinate, I would imagine that they would be looking on kind of puzzled and envious of the United States because, yeah, everything they need to stamp out the virus right here in the US exists in the US. And it's basically the culture and politics of this country that's prevented that from happening.
And when we look at the statement that the CDC director made and the number of other leadership has also followed about the pandemic being the pandemic of the unvaccinated, a lot of people also don't agree that this is a fair assessment in the sense that the unvaccinated are not a monolithic entity. There actually might be people with genuine issues of access or genuine questions or medical issues. And we've seen these inequities being played out during the pandemic as well. So is this narrative painting everyone with the same stroke sort of fair, do you think?
Well, I mean, I think it depends on how you think about it. If you think of the pandemic of the unvaccinated language as being not a judgment against the unvaccinated, but a description of who this virus is preying on, who it's a threat to, who it's spreading among and hospitalizing and killing. You know, the numbers vary state to state, but it's something between 96, 97, 99% of those hospitalized and dying are unvaccinated. Right. I think Rachel Walensky, the CDC director, Walensky, she said in a briefing to reporters that, you know, your risk of getting the disease is 7 times higher if you're unvaccinated, and your risk of being hospitalized is 20 times higher. That's just the risk to you. And so, you know, those are stark numbers. And when you look at who's getting the disease and who's suffering from it, who's dying from it, is it a pandemic of the unvaccinated? If, like one Republican governor or 2 Republican governors recently who have tried to take a harsher tone on it and make it clear that they want people vaccinated and that it shouldn't be a political issue, they've said, you know, it's time to start blaming the unvaccinated. Maybe it gets a little bit more complicated. There are people who genuinely can't take it for whatever medical reasons or have difficulty accessing it for, you know, economic reasons or physical health mobility issues. But also, I mean, we talked about conspiracy theorists and Trump supporters who are trying to stick it to the libs by staying unvaccinated and think it's a freedom issue. But there are also many other groups. And maybe there's an issue of education. Maybe there's an issue of walking through it with people. Maybe there's an issue of longer discussions. Young people, especially sort of university-aged people, 18 to 29, have really low levels of vaccination. And part of it is that in the initial vaccine push, they weren't eligible. But they have been now since, I believe, May at least. But they also don't see a direct risk to themselves. The young and healthy have traditionally had relatively mild, in it as a general rule, relatively mild cases of this. They don't notice the symptoms or their friends don't notice the symptoms. And maybe so it's hard to sell them on the value of getting it, especially if they have vaccine hesitant people talking to them about perceived risks. The Black community in urban areas and elsewhere is another group where vaccination rates have lagged. And one of the explanations that's come up a lot is that the Black community has a long history of reasons why they mistrust authority and medical authorities, that in the past, they've been told you need to do this. And when they do it, it turns out badly for them. So depending on where you're standing, looking at various people's reluctance or objections, there's different degrees of empathy that you might extend to them or different degrees of understanding where they're coming from. And I think the strategy needs to talk to all those different groups in their own language. I was reading a news story the other day in a New York City paper. I believe it was the New York Times, talking about the mandate and city workers they were talking to. And, you know, one garbage sanitation worker was just saying, you know, hey, I'm kind of lazy, right? Especially after I work 10-hour days. I just haven't got my butt down to the drugstore to get this vaccine. Now I probably will, now that there's a mandate, right? That a lot of us who follow this every day think about it every day, journalists and political professionals, but also lots of other people who have taken a big interest in this are following it and you can't really conceive, but you can't totally underestimate the capacity of people to just let things go and let them slide. And they're not even really vaccine hesitant, but they're not vaccine enthusiastic either. And they haven't gone out of their way. And so maybe things like mandates or the alarm over the rising spread pushes them. But there's a lot of factors. And I think you make a good point that there's a difference between describing how and among whom this virus is spreading and is the greatest threat and saying, well, how should we blame them? And in what ways should we punish them? Those are different questions. And I think the latter one, nobody that I'm talking to regularly is thinking that that's an important thing to deal with at this stage.
You mentioned freedom. And in this context, when I talk about the unvaccinated, I mean those who are willingly unvaccinated. So how does this crisis play into the culture, the so-called American way, which is a long-standing narrative that focuses on individual freedoms and choice? And here we are in a pandemic where our survival might actually depend on collective actions and looking out for each other. How does that play into this?
Yeah, I was looking at this and thinking about the early stages of the pandemic. The United States did not do well. They had famously, the highest death toll from this disease in the world in raw numbers, I think. And it's certainly among higher numbers, even as a percentage of population. It spread widely here. They had a hard time controlling it even during the lockdowns. And then when the early days of the vaccine approval, the US seemed to skyrocket to become this great success story. And it's like, initially, there's this collective action challenge, but also a government action challenge where you try to shut down and prevent people from going about their regular daily lives and, ask them to wear masks, ask them to stay away from their neighbors and friends and loved ones, ask them to close their businesses for an extended period of time. And the US didn't do well at that. And the US is also not a country with a long history of ordering people to do those kinds of things against their own will. There are still many states that don't have seatbelt laws on the idea that it's your freedom to risk your own life. Then when it became like who can buy the most vaccines and most quickly distribute them all across the country? Well, this is almost like a capitalism thing, right? The US certainly is a very wealthy country, but beyond that, logistics of supply chains and just-in-time delivery, and also sort of like the big, almost kind of military challenge of like, can we turn a football stadium into a vaccination clinic overnight and get the required number of doctors and the technology in place? Like the US is really good at that stuff. But then after the first wave of vaccinations, it becomes a challenge of like people buying in and getting vaccinated, not only for their own protection, but for the protection of all their neighbors to prevent this. And again, we sort of see them lagging behind, say, countries like Canada. And now this is just me, trying to project my own observations into a kind of a theory. But I just think this is a country that will not ban assault rifles in many states, like people from just carrying them down the street in everyday situations. Loaded assault rifles, they won't ban them because they believe that it's your freedom to carry that gun. And lots of people believe they need or want to carry that gun because they think they can do a better job protecting themselves than the government can. And I just think there's a kind of an ethos underneath that is against the government ordering people to do things. And a significant part of the population refusing to do things that the government suggests they do on the basis that they know better than the government. And I think you see parts of that kind of cultural attitude, both at the government level and in the responses to the government, in exactly this kind of challenge of if people would just get vaccinated for their own good and for the good of all their neighbors, you could solve this problem. But nobody's going to force them to, and they're not going to do it just because you told them to.
But at the same time, we are seeing officials across the US rolling out potential new vaccine mandates like in New York, and there's been talk of more mask mandates as well. Is this a sign of things to come? And how are these developments being viewed, especially with so much pushback on COVID restrictions and vaccines in several states already?
I mean, the answer to that is that to some large extent, it depends on where you are, and it will evolve over time. So as you say, in New York, there are now vaccine mandates for public employees. They have to get vaccinated or prove that they're getting weekly tests. A similar rule has been implemented for federal employees of the federal government. New York City has just implemented a vaccine passport system, essentially, where you have to prove you're vaccinated to do indoor dining or go see Broadway theater. And so we may see more of that across the country. And Joe Biden is encouraging places where there's high spread to pursue those kinds of things. On the other hand, in places like Florida, you have a governor who has, banned vaccine passports, banned mask mandates at the municipal level. And you see similar things to that in Texas, in both of those states where spread of the Delta variant is very high. Joe Biden's telling them, if you can't lend a hand, get out of the way at least. And yet, there's a real push against mandates, not just on this, but in general in the United States. The Obamacare health insurance plan, the most controversial part of it was the individual mandate, which made it universal health care. Said everybody had to have health insurance. And that was what was going to make the whole system work. That was, pursued all through the courts and eventually was the only part of that law repealed by Donald Trump. And so, in this country, there's a culture of pushing back against government forcing you to do things that I don't think is going to go away. But the more that this becomes a crisis, if it becomes a greater crisis than it is, I think the more you're going to see a return to the kind of social distancing measures, potentially lockdowns, mask mandates that we saw earlier in the pandemic.
Just quickly, if you will, Canada is also dealing with almost 6 million of its population who are yet to be vaccinated, although the vaccination rates are pretty high. But could the situation escalating across the border affect Canadians in terms of the borders, in terms of travel and trade?
I mean, it could. The thing is that trade between Canada and the U.S., so it wasn't unaffected, but very early on, Canada and the U.S. made some border agreements that allowed trade to go on relatively uninterrupted. And I think that those habits are ingrained in now. Those trade routes are built in. I mean, I think one thing that many Canadians would be worried about is now that Americans, fully vaccinated Americans, are able to travel into Canada as tourists as of August 9th, just as the Delta variant's becoming a significant problem again in the United States, should they be worried about that? And I think the rules allowing fully vaccinated Canadians to travel back into the country and fully vaccinated Americans to visit the country require, first of all, that they be fully vaccinated and provide proof of that, and that they provide a negative test taken within 72 hours of arriving. I think we're talking about a really low-risk group of people that's being allowed in. Most travel to Canada in normal times among Americans is concentrated in, border states, places like New York, Michigan, and New England, Washington State, where vaccination rates are relatively high. They're not the crisis hotspots right now, but also the people coming. This is the 50% of the American population that is fully vaccinated. And so, there's relatively little risk to Canadians from that. But I mean, I think we're all tied up in North America. Canada and the United States and Mexico are, integrated economies and to some extent integrated cultures. And if it becomes a long-term dragging on problem in the US, it becomes a problem in Canada. And one other thing I'll say, and I haven't done a significant amount of research into this, which is why it may be a significant thing, but I don't want to get into too much detail. But the CDC director was saying in the same briefing that we've been talking about that, we may be only a few mutations of the virus away from one that's vaccine resistant itself. And that's the real nightmare scenario, is that the more the virus spreads, the more we see mutations of it. And if a vaccine resistant mutation were to arise, we're almost back where we started, right? So I don't know how big the risk of that is in the short term, but it is a worldwide risk that continues to hang out there the more we fail to fight the virus as effectively as we can.
That's a really scary thought. So let's hope that never happens. Thanks once again, Ed, for presenting such a clear picture.
On that happy note.
Let's hope for the best. Fingers crossed. Thank you.
Absolutely. And always thank you, Saba.
I was talking to the Star's Washington Bureau Chief, Ed Keenan. That's it for today. Thanks so much for listening. I'm your host, Saba Itazaz. The This Matters team is Adrian Chung, Brian Bradley, JP Fozo, Matt Hearn, Morgan Bucknick, Raju Mutter, and Sean Pattington. Our music is by So-Called, Mike DeAngelis, and Sean Pattington. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com/subscribingmatters And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.